we give services gradually. Most of our services are for free. Others which are not for free, they are waived because we charge what we call a user fee charge. So it's a small fee. Like for example, we do antenatal for free, which we pay 1,000 throughout the entire period. You are supposed to have more than 4 visits, but you only pay 1,000.
Kamuli Mission Hospital, you have been doing very good in the camps, in the coordination we have. And we referred to the fistula camp. I don't know whether you're aware that social level did the fistula camp here. And you're still doing it.
I'm Mukalazi Henrygarvin, coordinator Hernia International. Hernia International is a UK-based charity with offices in the UK. And I was approached by Professor who was the former president of the Society of Orthopedic Surgeons in Europe for the last 20 years. He wanted to see how we could help patients with hernia due to the fact that with the ordinary person method of hernia repair, there are higher chances of recurrence. The surgeons in the house with doctors who are taking personal hernia, they are witness. So one of the areas we identified was that there is inadequate alphabet of mesh that we often use. Even when a patient has money, it's not in, you can't find it in many cases.
What resources in the hospital could be sustain hernia services in human, financial, physical.
For the physical, we have a good theater. Actually, it is a big theater. It has 2 major rooms and 1 minor, what they call a minor theater. So in terms of physical, it's okay. Then the human resource, we have adequate numbers of medical officers. The challenge we usually get when we have, for example, camps, in terms of human resource, is that we have to mobilize nurses and other staff from other wards to come and support the process. So the theater human resource may not be adequate. For example, running the normal procedures and then added, let's say, camp going on. So there is that shortage in terms of, especially the nursing staff. But for the doctors, we are fairly comfortable.
Do you have access to commercial meshes? If not, what are the alternative using?
We purchase them from Kampala. If we are to use a mesh, usually a surgeon that we will work with helps us to get one. They are not readily available, the meshes. If a patient deserves to be worked on with a mesh, we usually make an appointment and plan so that the mesh is available, then we can work on them.
In this project, we look at how we can help facilities make their own mesh using the resources available. When you look at the mesh that is out on the market, it's made of polyethylene. And then there's another material, like there are special nets that we often get from a certain company in India that has the same type of components that are in the mesh that is out that is sold. So this thing has been out, it has been used. There's a number of journals and literature about it and how it is prepared. And we want to switch this idea to Kamuli and to other facilities within the country so that patients can get access to hernia surgery. how much will it cost for a hernia operation with professional fee, theatre, and everything? What would be the estimate of the cost that if hernias are responsible?
We do costing in terms of medicines and also people who are going to participate. Sometimes the way we do our camps, people who participate, they are paid. Then there are people also who monitor patients after the camp has ended, because they are supposed to continue to be admitted until when they recover. So we do costing, but on average, our hernia, which is not complicated, it goes to around an average of 600 to 800. Because here, being a charity hospital, we don't charge much. Maybe one will go 1.5, but ours it is lower note.
Abandi budget era abandi wakyagana nga tibendera kujja muyiwaliro kale era Dr. Nkyabire buli kyetagisa abantu kubasomesa.
Hernia International as a charity has groups of over 20 surgeons that do surgery around the world. They have done this for the last 20 years. So we hope if this goes on well, we can always organize hernia surgery whereby the surgeons can come and pass on the skills, or even work with the local specialists to extend the skills. We've already engaged the National Drug Authority and we've got certificate of importation and we've submitted all the literature. So we hope if the project goes through, importation of equipment and other things will not be